right. Well, hey, everyone. I hope everybody's doing well. I just wanted to remind you first thing, today, our virtual open house, if you call the office today, you'll be entered in our raffle for fabulous prizes. They're listed on our website. So if you order products today, you'll be entered into the raffle. Also, you can call, schedule consultations, speak to us. But yeah, appreciate everybody viewing today. And read a couple of the questions I've received for the Botox presentation. One person asked, Melissa, will Botox help my jowl area? And that's a really good question because it depends on the patient. But like I was saying in that presentation, Botox, when injected into areas that depress the low face, the opposite occurs. So if one is really heavy in the posterior part of their jaw and they're just kind of pulling on this area and maybe their neck bands are pulling down, when we inject Botox into specific depressing muscles, you'll expect a more contoured jawline and thereby kind of lifting the jowl area. So again, every injection is based on assessment. We have to assess you and determine if you're a good candidate. But you can absolutely use Botox to reduce jowling and also contour the jawline. The other added bonus of doing the neck bands is prevention. As women, we sometimes are very self-conscious about how the neck ages, rightfully so. So what happens is over time, we lose skin laxity. Are very prominent. So by injecting Botox conservatively in the neck bands, we prevent the progression of the skin laxity in this area. So I really, really enjoy doing neck bands and low face depressing muscles for women who just want to kind of angulate that jawline or make a nicer neck profile. So that's a great question. Let's go ahead and look at the next question. Melissa, how does it help frowning, angry face? I work in front of a computer. That's actually a commonly asked question for people who work in the industry where they are furrowing or they're focusing, or I've even had patients who have said for years they've had kind of bad eyesight before they got glasses and they really contract on that middle muscle. So the great thing is when we inject the muscle between the brow, like I mentioned in the presentation, you actually get a brow lift. And what I mean by that is that muscle pulls down and it's harsh and it's strong. And over time, we kind of just get low and our lids get low. But when conservatively injected, the opposite occurs, where when after 7 to 14 days, when that Botox kicks in, we look well rested, we look more awake. We don't have to look at people and focus on the fact that we're frowning. I can't tell you how many times I've heard patients say, you know, I'm speaking to students or I'm speaking to my husband and they're saying, are you mad? And I'm not mad. So people don't want to look mad. And this muscle group between the brow is injected quite often because you get that nice refreshed medial lift between the brow. The next question I see here talks about natural looking Botox. And that's a great question because I tell patients and we tell patients here, when you have an expert injector, when you have somebody who's done it for years, we assess your muscles and we're going to determine what type of dosing we're going to use based on your anatomy. So when it's done correctly, one should look soft, more awake. I always tell patients, you know, when you go to the beach and you're kind of looking at yourself and you feel like you look more refreshed, you know, a lot of times patients will say, I had Botox injected. Nobody could tell, but people kept commenting that my skin looked gorgeous or my hair looked nice, or my husband said, oh, your skin looks really pretty. So yes, Botox should look natural. Unnatural Botox is not our rule, and it isn't our philosophy here. So that's why it's important to, at Dr. Greg and Dr. Blue's office here, all of the nurse injectors here have extensive certifications and experience, so we can assess how to inject, but also give a natural, fresh appearance. So that's a great question. It's a common question. Let me see. I'm looking at questions here. Okay. Sorry, my eyesight isn't great. Let me look at one of these questions here. How do I know my Botox dose? Okay, that's a really good question. Keep in mind, researching is fantastic. Now that we have the internet and we have resources to go and educate ourselves at home, that's a great resource. However, it's important to know that just like any other specialty, you're not going to be able to diagnose your dosing based upon your own research. Typically, you have to sit down, do a consultation with one of us or an experienced injector to determine what your Botox dose is, because it's case dependent, it's anatomy dependent. And so here we typically always will assess you, start on the conservative amount, and then see you back 2 weeks post injection and assess if you need more. You can always add Botox, you can't take it away. So our philosophy is always conservative, but also finding your clinical dose that you're comfortable with and working with you. So it's not, you can't necessarily find your own Botox dosing without having a consultation. And we're here doing virtual consultations right now. You can call and set up an appointment, and somebody can actually, one of us can call you back and assess you and determine what your Botox dosing is. That's a great question. The next question says, what age do you recommend starting Botox? I believe this is a great question. And here's the deal. Now that we have so many resources and so many platforms in which people can educate themselves on Botox, we're finding that a lot of the population starts earlier to prevent, but really there's several stages in life that you can receive Botox. There's no right or wrong answer. We might use it to prevent somebody from getting lines, right? Or we may use it to correct a line that really bothers somebody. Or we could use it just to assess, just to lift certain areas of the face. So there's no right or wrong answer with what age. Ideally, if one can start it a little bit earlier so we can get ahead of the game and kind of stop the reinforcement and the strength of the muscle, that's great. But we work with patients of all ages, and we just, again, we assess your muscle and then we inject appropriately. I think I have time for one more question. Let's see here. Aw, everybody's so nice. Thanks for tuning in, guys. Really try to call today if you receive any products or order from us, and we're here to answer questions. I'm here today as well. Products are 20% off today, and it will allow you to enter into a raffle, and we have the best raffle prizes I've seen during this virtual consultation. So I would really highly recommend, if you need any help determining what products are best for you. I am here today, and there's several people here today, but just give us a call. We can talk to you. But today is a great day to get that 20% off and enter into a raffle. I'll do one last one here. Melissa, what is a Botox brow lift? Okay, that's a great question. A Botox brow lift is typically on a patient. We assess if the tail of your brow, if we could put a little bit of Botox in the tail of the brow to give it a little bit of a lateral lift. Now, not everybody's a candidate for that. So if you are a candidate, it's a very conservative amount of Botox. And what happens is it just gives you a subtle lift on the brow. It's very simple. It's virtually painless. But again, coming in and speaking to one of us and determining if it's a good brow, that's the best way to go. But Botox brow lifts are great just to kind of lift brows and to also even brows. You know, there's symmetry components where sometimes people have asymmetric brows, and we'll, you know, Botox brow lift one side and one will have a more even set brow. So thank you everybody for joining. We are here today, and any questions you can email me. You can email any of the providers. Our emails are on the website, and I encourage you to look at the website to look at our raffle prizes. Thanks so much. Stay safe.